Hello, everyone. So this last mini lecture for Chapter 10 will focus on some other topics that we want to cover. In particular, we're going to start with risk assessment, which is another area of assessment in criminal cases. So what is it? You would evaluate the likelihood that a person will be violent in the future, their violence towards other people. Barefoot v. Estelle in 1983 talked about permitting the introduction of mitigating circumstances. Psychiatrists can testify about the likelihood of future violence. This was the first time that this was clearly permitted. This is a factor in death penalty evaluations, and it's not very accurate, to be honest, but you can still testify about it. Shell v. Martin in 1984 rejected the contention that it's impossible to predict future behavior. This is used in bail situations, so you can use professional testimony concerning future violence, and also in pretrial hearings, and the court ruled that this is okay. Kansas v. Hendricks in 1997 says that you can use risk assessment for civil commitment and prediction of future sexual violence. Overall, these cases show a belief that experts have the ability to testify concerning future prediction of violence. So when are experts asked to predict future violence? You always do this in normal clinical practice. You always have to decide if that person is a risk to themselves or maybe to someone else, and it's really important, like that Tarasoff case we talked about much earlier in the semester. In death penalty cases, either for the defense or the prosecution. In civil commitment, this is one of the criteria, the main criteria, to be honest, for civil commitment is, are you a danger to yourself or to others? Pretrial detention cases, pre-sentencing evaluations, will there be repeated violence, usually whenever crime involves a violent behavior? And whenever there's a question of releasing people, parole, or from civil commitment. The core of all this is the protection of society. So we want to try to predict whether society will be safe if this person goes free. So there are two ways to predict future violence. There is the clinical prediction, which is the judgment made by the clinician informed by research. And there is the actuarial or statistical prediction, which is based on data and research and uses decision trees. So Grove et al. In 2000 says that actuarial prediction is about 10% more accurate. And the MacArthur Violence Risk Assessment Study says that the best prediction of future violence is past violence. And in general, for behavior, this tends to be true. The best prediction of future behavior is past behavior. You use a decision tree to put people into categories. So 5 is low to high risk. And it's 5, so going from low to high risk. And this is a good classification. The lowest classification, people were put in that low risk group, only 1% of them engaged in violence, as opposed to those who were placed in the highest group, about 76% of them actually engaged in violence. Now, in terms of the assessments that can be used, that PCLR, Psychopathy Checklist Revised, is the only thing recommended. And if you remember, we talked about this and we talked about psychopathy. People will also use, and they're considered acceptable, the MMPI-2, the screening version of the PCL, the WASTE that we've talked about several times, and the PAI. Those are all considered acceptable, but really it's the PCLR you want to use. Next thing we're going to talk about is malingering. You've heard me use this term already, but just to really clarify, this is the intentional fabrication or exaggeration of physical or psychological symptoms motivated by external incentives. You don't want to go to jail. In civil cases, we'll see this motivated by money. It occurs about 15 to 17% of the time, so certainly higher than some of the other things we've talked about, but still not all the time, as we might assume. However, we see this could be higher in some settings. So there's some studies that suggest up to 41% of those who try an NGRI plea might be malingering. So how do we detect it? We want to look for rare symptoms that even psychiatric patients don't endorse. We look at improbably combined symptoms. Those with a preposterous quality, off the realm, no one would have these. We want to look for, again, symptom combinations, like grandiosity, energy, but feeling like you need to sleep more. Those don't make sense. You can't, one goes with a manic episode, one goes with a depressive episode. Symptom severity and distress. So people who are psychotic are often not distressed by strange symptoms. Indiscriminate symptom endorsement. So if you give them the MMPI and they're just like, yep, I got that, I got that, I got that, you need to kind of red flag. Obvious versus subtle endorsement. So they may only endorse obvious symptoms, but miss the subtle ones that go with these disorders. So for example, people with psychosis, yeah, they hear things, see things, but they often also have some other things like flat affect or flat emotions, which someone who wasn't as versed or didn't actually have the disorder might not know. And then there's reported versus observed symptoms, where you might say one thing but act a different way. And one thing I'll say is that most people who are mentally ill don't really want to talk about it. A lot of people who are mentally ill don't even present for therapy. So if the person is really eager to talk about their symptoms, that might also be a red flag. There's no single perfect strategy. And then for cognitive malingering, for things like intelligence or memory where they're faking it, you want to look for excessive impairment. If they're doing worse than chance, they seem like they're deliberately choosing the wrong items, or you look for unexpected patterns. They do just as well on easy and difficult items. Someone with true defect often will do better on the easy items. So what can you use to detect malingering? The MMPI and the SEERS are the most recommended. So the MMPI-2, the Minnesota Multiphasic Personality Inventory, we've talked about already this semester. It has 3 what are called infrequency scales, F, FB, and FP. And these are when people malinger, they endorse infrequently endorsed items, which then go on these scales. So they're endorsing the severe symptoms that even someone with a severe disorder wouldn't endorse. So their scores go up. People who are coached will often do this. So Storm and Graham had a study where they looked at this. They had 3 groups. They had students who had just had the normal instructions for the MMPI. They had students instructed to malinger and coached to malinger. And then the third group was psychiatric patients with normal instructions. And the people who were uncoached, the MMPI did pretty well at detecting that F and FP. Those who were coached, you actually have to use lower cutoffs because they'll endorse fewer items on these. And there are 2 types of coach malingering. You can be coached to symptoms of specific disorder, or you can coach to a test, a malingering scale. If you're giving information about the disorder, you score more like an actual patient than those who are not coached, but that does not affect the ability of validity scales to detect malingering. The SEERS is the structured interview of reported symptoms, and this was developed to assess feigning. It takes about an hour to give, and it's based on strategies for identifying malingering. Classification rates are greater than 90% in just about all cases. This is not practical always in routine forensic work. It gives additional support to see the possibility of malingering on other tests. The MFAST is the Miller Forensic Assessment of Symptoms task. And this is a shortened task using the same detection strategies used by the SEERS. It's 25 items, 5 to 10 minute structured interview. It's newer, so it doesn't have as much support as the SEERS. And it's better at ruling out malingering than proving that someone's doing it. At best, this should be a screening measure, and then if someone is looking kind of weird on this, then you give them the SEERS. Then it's worth giving it to them. The Portland Digit Recognition Test is where you provide someone with a 5-digit number and then a distractor, and you have them choose the number from a pair of numbers. People think this hard, but it's not. So the more they get wrong, the more likely is they're malingering. Similar test is the test of memory malingering, or the TOM, which was created, I joke you not, by a guy named Tom Tombaugh. Loved his name. And it's 3 flip books, and you show the people 50 pictures, and then you ask them which have you seen before. So of the pictures from a pair, just like on the digit recognition test, which of these 2 pictures have you seen before? Again, people think that this is really hard, but in actuality, most people get close to 100% correct. Again, there's 50 items, and if you score, I believe, somewhere below 45, you're considered to be malingering, because this is so easy for people. All right, now we're going to talk about juvenile transfer. So forensic psychologists sometimes evaluate youths whose criminal cases are being considered for transfer to adult court. Those evaluating juveniles for a possible transfer must focus on the risk of failure, future offending, the interventions needed to reduce the risk of future offending, and the likelihood that the youth will respond favorably to those interventions. States vary in their specification at the age at which an adolescent is eligible for being prosecuted in the adult criminal system. A lot use the age of 14 or 15. There are several justifications for transfer into the criminal system, the adult criminal system, if they've been charged with homicide, if they've been charged with other specific violent felonies like sexual assault, or if they have a history of prior juvenile offending. Juveniles can be transferred to the criminal court in different ways. So statutory exclusion is where the state legislature can determine that certain offenses must be filed directly in adult court, such as homicide. The judicial discretion is that the juvenile court can decide whether the youth should be transferred to a criminal court. And then prosecutorial discretion is where prosecutors can decide whether cases are to be filed initially in juvenile or adult court. Is putting juveniles in the adult system effective in reducing reoffending? There has been no decline in juvenile crime after these transfer laws came into effect. And housing juveniles with adult criminals may actually promote criminal attitudes and motivations, give them ideas. Higher rates of recidivism have actually been observed when the youth are transferred, so they're actually more likely to reoffend. Juveniles in adult facilities were more likely to be sexually and physically assaulted as well than juveniles in juvenile facility. Juvenile transfer may also include in the other direction. So juveniles placed in adult court are returned to juvenile court. That's called reverse transfer. Some 25 states currently have reverse transfer procedures that allow juveniles in adult court to petition to transfer back to juvenile court. All right, so that is it for Chapter 10. Thanks for hanging with me through this lot of information. And I will look forward to talking to you in the next chapter.